Did you know that all medical professionals are mandated reporters to Child Protective Services? Unfortunately, there are numerous conditions that may mimic child abuse, and pediatricians who are known as experts in identifying child abuse may be very quick to report, and their word is taken very seriously. After all, if you're looking for child abuse, you'll start finding it everywhere you look. For example, Glutaric aciduria type 1 is a deficiency of glutaryl coenzyme A dehydrogenase caused by mutations in the GCDH gene. It's typically characterized in infants by an abnormally large skull, low muscle tone, irritability, developmental delay, and convulsions. Hemorrhaging in the brain is a high risk in Glutaric aciduria type 1, and as a result, it is known in the medical community that this disorder can mimic abusive head trauma. Menkes disease, caused by mutations in the ATP7A gene, results in an accumulation of copper in the body. It's characterized by abnormally steely hair, progressive neurological deficits, liver abnormalities, and connective tissue problems. These symptoms may cause abusive head trauma. Because of this, it is known in the medical community that Menkes disease can mimic abusive head trauma. Cobalamin C Deficiency, caused by mutations in the MMAHC gene, leads to a deficiency of vitamin B12. Symptoms include failure to thrive, intellectual disability, lethargy, seizures, and anemia. As a result of these symptoms, as well as severe brain complications found on imaging, it is known in the medical community that Cobalamin C deficiency can mimic abusive head trauma. Neurofibromatosis is a group of genetic disorders causing tumors on the nervous system. Type 1, the most common type in children, presents with flat light brown spots, neurofibromas, intellectual disability, developmental delay, and skeletal abnormalities. Hemorrhaging caused by these tumors in particular is also known in the medical community to be able to mimic abusive head trauma. Marfan Syndrome, a dominant genetic disorder affecting connective tissue, results in musculoskeletal, heart, brain abnormalities, and elevated risk of brain hemorrhage. As a result, it is known in the medical community that this syndrome can mimic abusive head trauma. Loeys-Dietz Syndrome, another genetic disorder of the connective tissue, causes skeletal malformations, abnormal scarring, and high susceptibility to bruising. As a result, it is known in the medical community that this syndrome can mimic signs of child physical abuse. Pycnodysostosis is a genetic disorder caused by mutations in the cathepsin K gene. Symptoms include bone fragility, short stature, and an abnormally large skull. The fragile bones may break more frequently, which is known in the medical community to be able to mimic signs of child physical abuse, especially if multiple healed bone fractures are found on imaging. Osteogenesis Imperfecta is a group of genetic disorders that cause fragile bones and skeletal abnormalities. It is known in the medical community that the frequent fractures caused by the disorder can mimic signs of child physical abuse. Ehlers-Danlos Syndrome is a disorder of the connective tissue. Type 4 specifically can present with brain hemorrhage. It is known in the medical community that this syndrome can mimic abusive head trauma. Rickets, a deficiency of vitamin D, can lead to frequent bone fractures, which CPS may view as abuse. However, it is considered to be somewhat controversial as a medical mimic of child abuse in the medical community. Hemophilia, von Willebrand disease, and factor XIII deficiency are clotting disorders that increase the chances of bruising. It is known in the medical community that these disorders can mimic signs of child physical abuse. Don't wait for the worst to happen. Protect yourself and your family from allegations of child maltreatment due to a misdiagnosis of your child. Visit cpsprotect.com or call toll-free at 844-633-KIDS to protect your family now. CPS Protect Consulting Services, saving children, preserving families. The information provided in this video is strictly for educational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional for medical concerns.